And a cardiac catheterization is when we take long, thin plastic tubes, we actually go up the patient's leg vessels or through other vessels into the body. We go directly into the heart. We can check pressures. We can check the oxygen content of the different chambers of the heart. We can squirt in some contrast or some dye to see where the blood flows. Initially, what we're doing with the catheters, when we're going up the leg vessels, we're checking the pressures on the right-hand side of the heart or the right-sided vessels. In her case, because she's had surgery, the vessels have been rerouted slightly. Her head and arms and the vessels from the legs and belly all drain to the pulmonary arteries or the vessels to the lungs. We were checking the pressures across that stent, making sure how much pressure difference there was. When we took the picture, we wanted to see how big the stent was. It was definitely too small for her size as a 10-year-old girl. After that, when we put in a wire position, we used a special catheter that had a balloon on the end, and that balloon basically dilated open that stent. After dilating open that stent, we wanted to take a picture to make sure that basically everything still looked good. The stent was in a nice position. There was good flow through the stent into the pulmonary arteries, so she could basically have nice oxygen levels. And then after that, we repeated the process with a little bigger balloon, took the stent even bigger, and did the same process of checking the pressures across the stent, making sure that there was no more pressure gradient, and then taking a picture again finally just to make sure that, again, after the final dilation, the stent's in a nice position, good blood flow to the lungs, and everything looks good. After the cardiac cath, she'll have very little scar. There's usually a period of, like if you were to cut your skin and have a little bit of a cut. It's a very similar looking type of scar initially, and after a few weeks it's usually very difficult to see.